The provision of health care for those who are uninsured and underinsured is one of the principal responsibilities of Cook County government. And while we're facing incredibly difficult economic conditions and asking everyone to do more with less, I take the county's commitment to health care very seriously. And I want to thank those who have joined us here today because we all share that commitment. When we put forward our budget, we put a high priority on reducing the subsidy of the hospital system without impacting the level of care. Dr. Raju and his staff worked diligently with my office to make this a reality, and it's something we're particularly proud of in this budget. We're here today to announce 2 new public health initiatives within our fiscal year 2012 budget. Because we've made tough choices in our budget, we can invest in public health to ensure suburban residents have access to primary care physicians and our youth have access to the dental services they need and deserve. We'll be increasing the funding for Access to Care, a primary health program serving low-income, uninsured, and underinsured individuals throughout suburban Cook County by $1 million, raising our support from $2 million to $3 million. Preventive primary care is essential to increasing the health of Cook County residents. Through the program, Access to Care contracts with local providers and pays them a discounted rate to provide routine medical exams, diagnostic labs, X-rays, and prescription medications to underserved populations. A total of approximately 4,350 low-income residents will be linked with a primary care physician through this grant. We will also be restoring $1 million to funding for outpatient dental care. Not everyone realizes the critical need for increased dental care provisions in Cook County and nationwide. During the campaign, I met with several dentists and dental care organizations who told me horrifying stories about the consequences of insufficient or inadequate dental care. A recent Surgeon General's report on oral health documented linkages between poor oral health and a number of other diseases, including diabetes, stroke, heart and lung diseases, low birth weight, and premature births. In Cook County, we have large areas which have been designated by the federal government as dental health professional shortage areas. The Surgeon General reported that low-income residents are most vulnerable to poor oral health, with low-income children and older Americans being particularly vulnerable. In Cook County, 64% of third graders have had cavities and 39%, almost 40%, have untreated cavities. We're taking a broad strategic approach to health care in Cook County because we know there are tough choices to be made, and we need to ensure that our taxpayer dollars are used as wisely and efficiently as possible. We're here today to announce a budget amendment that restores funding for 2 public health initiatives targeting care for low-income individuals living in Cook County. These public health initiatives will be critical to our treating of underserved patients and families throughout the county who are facing difficult economic circumstances. These investments will begin to close health care service gaps that have existed far too long in Cook County. I want to thank those who helped make this happen and pledge to continue to work with my colleagues on the county board and in the health care industry.
I'm happy to join the President and my fellow commissioners on this amendment. As she outlined, access to care as well as the dental, the amendment will help both hygiene, and that is a key. All you have to read is any health care article about the key for good health dental care, as well as the access to care. Health care is a right, not a privilege, and I salute the President on her leadership.
I'm pleased to join the President and the Commissioners today in what I consider to be a very important healthcare initiative for the residents of Cook County. At a time when the financial realities of the day are bearing down at the doors, it takes a courageous leadership and far-sighted strategic thinking to invest in the future of the health of our residents. I'm thankful to the President and the Commissioners for the help in promoting community health, which is an important aspect of our strategic plan and also helps the system to prepare ourselves for the healthcare reform, post-healthcare reform delivery model. As more people are enrolled to the expanded coverage, we as a healthcare system need to think of very innovative ways to partnering with the community and professional organizations to provide and expand access. We have embarked on this journey with Access Care, a fine organization, for a few years, and now these initiatives really expands our effort to the next level. These initiatives also address the much-needed health needs of our community, and I'm happy to be part of this great day, a great day for the healthcare of Cook County residents. The future of healthcare system is based on providing adequate preventive care, a good primary care, and a better management of chronic diseases. These are the pillars on which the healthcare reforms are based on. Any investment in preventive health will help us to bend the cost curve and make our nation healthier. I'm happy that we are one step closer today by this particular announcement. The President and the County Commissioners have taken the right steps today, and I wholeheartedly support it. It rhymes with our strategic plan of expanding access to primary care and also validates the long, proud history of ours of providing preventive care to the residents of Cook County.
This amendment will mean a great deal to us to be reinstated to $3 million from Cook County. We have been funded by Cook County since 1991, and it has gone up and down over the years, and it has finally gone back up again, and I thank you so much. Access to Care contracts with local primary care providers in the private sector to take X number of people from our program, they choose, and add them to their practices. We separately cover the costs of lab, routine x-ray, and pharmacy, which is huge and is the biggest line item in my budget. I thank President Preckwinkle and Commissioner Schneider and all the commissioners who supported this so much, because this will allow us to add at least 1,500 people to our program. We have a waiting list of 5,000 people who have been declared eligible and who can't get in the program because we don't have enough money. So this will allow us to make a huge dent in that.
Hello, everyone. I am Dr. Cheryl Watson-Lowry. I'm with the Governmental Affairs Committee for the Chicago Dental Society. And the Chicago Dental Society, Bridge to Healthy Smiles, and the Illinois State Dental Society would like to thank President Preckwinkle and the commissioners for this effort. We believe that this is going to make a huge difference in the citizens of Cook County and the underserved community being able to have access to care in the dental area, and this can help in the prevention arena for these patients so that they can receive the care that they deserve.
Dental care is often an ignored problem in our county and our society. People don't see it as important as health care in general, but it is. Dental care is related to so many other health conditions and ailments and sicknesses and diseases. So it's very important that we continue to support dental care and to increase funding in this budget, the second budget year in a row where we've increased budget for the dental care. So I want to thank everyone who's involved. I want to thank the Chicago Dental Society, who was very instrumental in working with us to develop a plan. And remember, the world would be a better place if we smile a little bit more at each other, and you can thank your dentist for that.
Thank you, Madam President. I would just like to thank Commissioner Sivestri, who talked to me about this over a year ago. Also, Dr. Margos and Dr. Sieben of the Chicago Dental Society, who shortly after the election came to my office and began bringing to my attention the issues that existed with dental treatment. I'd also like to thank Dr. Raju and Dr. Mason and encourage them to continue to make dental care part of their budget on a yearly basis and to seek county assistance where appropriate.
I'm very pleased to be standing here today, and I'm honored to be sponsoring the budget amendment that will increase the funding for Access to Care by $1 million. As many of you know, Access to Care has been a program that has been a passion for me since I became a commissioner in 2006. In today's fragile economy, there are a growing number of suburban families who are struck in between being eligible for public health insurance programs and having medical insurance. The Cook County health system has long been an island, inaccessible to suburban Cook County residents due to geographical reasons. I discussed this with the President, the large number of uninsured and underinsured and the working poor in Cook County, and explained to her just how important the Access to Care program was. This additional funding as Victoria said, will serve approximately 1,500 low-income and uninsured suburbanites for a total of nearly 6,000 suburban residents. It's also important to note that this program uses existing infrastructure. There is no additional capital expenditures necessary. As a matter of fact, Access to Care delivers roughly $3 in service for every dollar that's put into the program. Simply put, this will allow Access to Care to better serve the underinsured and nearly eliminating their current waiting lists and fully leveraging the commitment of the physicians who have pledged to participate in this program. This effort is a positive step towards making Cook County healthcare dollars available to all residents of Cook County, a county-wide healthcare system, which is my dream, accessible to all people in Cook County. I want to thank the President for her commitment to this valuable program and to my fellow commissioners who support this valuable program. Thank you.
Thank you very much. I'm very grateful to the bipartisan support that we received from the Board of Commissioners for these additional dollars, both to Access to Care and to dental health care.